Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. April 25th is World Malaria Day, and today, Thomas Locke of the Johns Hopkins Malaria Research Institute returns to the podcast for another special episode on one of the leading causes of preventable deaths and disease worldwide. Let's listen.
It's hard to underestimate the impact of malaria. The disease infects hundreds of millions of people each year and kills over 600,000. That's the equivalent of the entire population of Baltimore being wiped out each year. But for those outside of malaria endemic regions, the disease often doesn't come to mind. It's a distant memory for those in the US, where the disease was eliminated over 70 years ago. But for some Americans, a diverse cross-section of society, malaria remains on their radar.
My name's Michelle Nelson, and I'm from Texas.
I'm Julia Naiman from South Carolina.
Martha Collins from Wisconsin.
Ellen Blasi, and I'm from Florida.
My name is Karis Luwamba. I'm originally from Zambia, but I go to school in Oklahoma.
We are united to beat malaria!
And so, on today's podcast, a day ahead of World Malaria Day, we're focusing on advocacy in the fight against malaria, because without funding, there can be no malaria fight, no bed nets distributed, no homes sprayed with insecticide, and no scientific research to develop new tools. So where does malaria funding come from? How can we encourage our politicians to support the fight? And what role do young people play in global health advocacy?
I'm Joy Pumapi, Executive Secretary of the African Leaders Malaria Alliance, and you are listening to the Johns Hopkins Malaria Minute, Extended, with Thomas Locke.
Margaret Riley McDonnell is the Executive Director of the UN Foundation's United to Beat Malaria campaign, formerly known as Nothing But Nets.
It is true that we eliminated malaria in 1951, and so it's not something that affects an American day in and day out. I think the reason that Americans care about this is because diseases know no borders. You know, the reality is that anytime you travel to an endemic country, you're susceptible to malaria. Malaria is actually one of the leading threats to members of the military when they serve in endemic countries. And so there's sort of the practical reasons of why, but there's also, moral leadership and imperative that Americans can understand that no child should die from a mosquito bite.
Margaret's campaign, United to Beat Malaria, brings Americans to Washington, D.C., the nation's political center, this year for the first time since COVID.
We're so excited to have our 2023 Leadership Summit in Washington, D.C. We have more than 100 individuals and representatives from partners coming across the country, representing 36 states, as well as a number of countries from Switzerland to Botswana, who are coming to join us to deepen their knowledge base, receive advocacy, communications, and partnership training.
A great number of those champions are young people, students of public health, of science. One of them is Himija Nanga-Reddy, the US Youth Observer to the UN and fellow at Johns Hopkins.
I serve as an Emerge Health Equity Fellow, which is a program based out of the Kennedy Krieger Institute in their Office of Health Equity. I'm here representing the voices of young people and their priorities, especially when it comes to global health and youth rights, given, the burdens that infectious diseases such as malaria pose on our most vulnerable, especially our most vulnerable young populations. Young people really do care about global health and well-being. They care about the effects that this pandemic has had, not only on other health issues and health effects, but also on the quality of life that many young people had been facing. Disruptions in their education, disruptions in their employment, had to take on the role of being a caretaker when they didn't have that role before, and now they were required to do that. Many young people had to be the combaters of mis and disinformation in their communities when there was a lot of that being spread with the pandemic. Young people have taken on such a powerful public health leadership role over the past couple of years.
Beat Malaria is mobilizing this passion to secure funding for the malaria fight.
We're going to deploy them on Capitol Hill this Tuesday to meet with their members of Congress and convey the importance of strong U.S. leadership and funding for programs like the Global Fund to fight AIDS, tuberculosis, and malaria, and the U.S. President's Malaria Initiative. The U.S. is the largest funder to the Global Fund. So the Biden administration pledged $6 billion over 3 years, or $2 billion a year. And we're so grateful that Congress honored that pledge in the fiscal year 23. So now we're trying to secure that funding again for fiscal year 24. With the U.S. President's Malaria Initiative, we're able to secure an increase in almost $800 million last cycle, and we're asking for more to ensure that the President's Malaria Initiative can continue to scale up the tools that are needed to overcome insecticide resistance, also to train more community health workers, which are the backbone of this fight, and to reach the unreached. We know that malaria is a disease that anyone can get, but it particularly preys on most vulnerable people who sometimes fall outside of the reach of traditional health systems. So we need to make sure we reach every person.
Those two resources, the Global Fund and PMI, make up the lion's share of malaria funding, the Global Fund accounting for over 60% of funding for malaria control programs. David Walton is the US Global Malaria Coordinator for PMI.
Both sides of the aisle recognize that no child should die from the bite of a mosquito. Congress understand the importance of controlling and preventing this disease, but also the impact that it has, the story that we can tell, the pride that we can have as the U.S. government and the American taxpayers contributing to, trying to eradicate one of these ancient scourges, as well as understanding that this really does contribute, even though the average taxpayer may not think about it, contributes to the health and safety of the American citizen, right? Because pathogens know no borders.
So we have these valuable resources for malaria that fund critical prevention and treatment interventions on the ground. But how do you go about convincing politicians, like members of Congress in the US, that they're worth funding? This is where United to Beat Malaria comes into its own. It takes this grassroots passion for malaria with advocates from different states, different backgrounds and different ages, and marries it with informed, compelling and evidence-based testimony from experts in the field. David Walton of PMI was at the summit, insisting we cannot take the foot off the gas in the fight against malaria. He gave a keynote speech on the challenges and opportunities in tackling the disease, starting with climate change.
We all see it, we all feel it, we're all experiencing it here. We've already seen some of the effects of these extreme weather events, like the rainy season in Senegal, going from 3 months to 4 months, and then also shifting periods of time. And so these things are going to affect our ability to predict, plan for, and respond to malaria over time, both acutely and chronically.
Resistance to anti-malarial drugs.
Artemisinin is the major and most effective medicine that we have against malaria. We are beginning to see resistance in Rwanda, in Uganda, in the Horn of Africa. If we lose artemisinin, we don't have many options left.
And the rise of a new mosquito species in Africa.
Its name is Anopheles stevensoni. The main difference of this mosquito is that it's urban, whereas the other mosquitoes that typically carry malaria are rural. We don't really know how to control it. Some of our prevention tools aren't as effective against it. And it thrives in environments that we're not used to doing intensive malaria control, aka the urban setting. We need to, as the mosquito is adapting, the parasite is adapting, we need to evolve. And we're always running behind, we're always playing catch up.
Also emphasizing this need to adapt and equipping champions with insight was Joy Phumaphi, former Minister of Health in Botswana and Executive Secretary of ALMA, the African Leaders Malaria Alliance.
We do not have enough money to invest in everything. We have to be very careful that the limited resources that we do have are invested in the right areas at the right time and used in the right way in order to effect the difference. So this is what we focus on. The most important work that we do is to work with the malaria program managers, with the ministries of health on the ground to ensure that they are actually improving the health management information system so that it can collect the data that informs the actions that they are going to take. That is going to inform the strategy development, that is going to inform the planning of the program, and that is going to inform the targeting of the investments.
We really need to think about shifting the locus of control, because with funding comes power and agency. With that agency, frankly, comes control. And so for a long time, we've been saying, this is what you should do, this is how you should do it. It's an outdated approach. It's something that we really need to shift from. And so we're doing what I think we've done in the past, but we're really turning up the volume and accelerating our progress to say, how are we going to put country programs in the lead, country scientists at the forefront, which they already are scientifically. We just need to put them, again, shifting that locus of control.
And here's the big picture. Investing in malaria goes beyond controlling cases and deaths of disease. It's about tackling health inequity and poverty.
One of the major causes, drivers of poverty in our communities is illness, recurring illnesses. And malaria is the most prevalent recurring illness on our continent, particularly amongst children of school-going age and children under the age of 5, who are most of the victims from mortality in malaria. But when you look at the morbidity figures, there are 234 million people on the African continent that get infected every year. A lot of them are school-going children. So they lose learning hours, and therefore they are going to, their learning outcomes are going to be reduced. The mothers who stay at home in order to look after them are going to produce less, whether they are farmers. Most of the food on the African continent is produced by women. It is the women who go out into the fields, who grow the food. It is the women who go to the market, who run the stores where this food has been sold. And the reduction in production in agriculture, the loss of household income because the mother cannot go to the market, has a huge impact on the economy. But we also have instances where workers in mines, in factories, are the most affected with the morbidity numbers. And so you'll find that it reduces productivity levels in the mines, and mineral production is one of the major drivers of economic growth on the African continent. So it drives poverty.
I asked Joy if ending malaria was her hope.
It's not my hope. It is my faith and it's my belief. It is my conviction. I know we can eliminate malaria, but I know that it can only happen if we work together. And it is our role as travelers on this road, as warriors in this fight, to make sure that we take everyone along. So this is what I work on every single day. And every time when I go to sleep, I ask myself, what more can I do tomorrow that can bring another soldier into the fold?
So those are the talking points that champions took to Congress. But back on the conference floor, looking around at the champions, you realise how diverse the room is. And as with any conference, it's home to household names. Companies that manufacture mosquito nets or repellents, or organisations like the Bill and Melinda Gates Foundation. But it's also home to people just starting out, young people passionate about malaria.
My name is Benjamin Voller-Brown. I'm a senior studying mechanical engineering at Arizona State University.
My name is Michael Lee. I'm also a senior in engineering, but biomedical engineering.
It started off for one of my classes. I had to do a project focused on global health. I looked up world's worst diseases, malaria popped up, and I kind of just ran with it from there.
We invented a malaria prevention kit that comes with all of the materials that helps people repair their bed nets. So one of the main problem of bed nets, they are expected to last 3 years whenever they're distributed. However, data has shown over and over again that nets are lasting maybe a year or two. Some starts to tear within 3 to 9 months. People see that their net is torn, they think it's completely useless, so they would just throw it out.
We have the instructions with a needle. We have our patching material. which we've found when it's applied to the site of the tear, it's able to double the tensile strength of the net at the site of the tear, making it highly unlikely for it to tear again. So like if you want to feel this, it's super strong, super durable, yet still really breathable and flexible. We've gone to Uganda in the summer of 2021, where this was more of just this was our first initial distribution. Do people want it? Do they like it? And do they end up using it? And what we ultimately found was that 94% of people committed to using our kit just upon handing it to them. And then when we went back a year later, 64% of them had used our kit to repair their net.
And this summit in Washington, D.C. is a networking opportunity for them.
Every single second is just filled with precious information, understanding how the industry works and stuff like that, and seeing what potential help we could provide for the industry through research or through other form of advocacy. I like to think of ourselves as people who are willing to do anything to contribute to the cause, eliminating malaria in the most affordable, the simplest way possible.
With dedication and commitment, the champions held over 140 meetings with congressional offices and generated over 30,000 hits on social media. It's hoped that these voices in Washington, D.C. will secure that vital malaria funding, because without funding, there's no malaria fight. And it needs the next generation of advocates to continue banging the drum for strong US leadership, because without funding, there is no malaria fight. And it needs the next generation of advocates to continue banging the drum for strong US leadership to help move the needle towards eradication and future-proof the malaria fight as the parasite and mosquito adapt. And if you're craving more expert insight into malaria, join us tomorrow, April 25th, for our 2023 World Malaria Day Symposium. 13 speakers from leading global research institutions are traveling to the Johns Hopkins Malaria Research Institute in Baltimore to present the latest science on this year's topic, blood stage malaria, staving off the firestorm. It's free to join in person in Baltimore or to tune in on Zoom. It's a great way to stay on top of the world's leading malaria science through short, impactful lectures from the world's leading research institutions like the University of Oxford, Harvard T.H. Chan School of Public Health, and the NIH. That's the 2023 World Malaria Day Symposium, online and in person, tomorrow, April 25th. Go to malaria.jhsph.edu to sign up. That's malaria.jhsph.edu, or search for the Johns Hopkins Malaria Research Institute. You've been listening to the Johns Hopkins Malaria Minute Extended. Subscribe wherever you get your podcasts from. I'm Thomas Locke.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.